let's cut to the chase. Does Champix work? And I'll use the word Champix because I think that's what most people are familiar with, that word. But varenicline Champix, the same thing. So look, if you look at the latest Cochrane review, there's been 27 trials with almost 13,000 participants. So a lot of participants here. And I think the most important statement we can make about this is that more smokers will quit successfully with Champix compared to placebo or any other intervention in all reviewed trials. And that's irrespective of the setting. Here are some of the key comparisons. If we're just looking at numbers quit per 1,000 in the various trials, so in other words, for every 111 people that we get to quit with placebo, we get 250 with Champix, and that gives us an odd ratio of 2.24. We know this is the real deal. This is 27 studies, all CO verified. So we know this is a real effect. This is a true effect. And even when we compare it to other smoking cessation medications, we still get superiority with Champix over those medications. So compared to Zyban or bupropion, for every 171 that quit with bupropion, we get 238 with Champix. Now this is 5 randomized controlled studies, CO verified. So we know this is the real deal, a real effect. Even comparing it to NRT, you're still far more likely to quit compared to single form NRT on average. It doesn't mean that, a patient or a client is going to be better off taking Champix. They may just do better with NRT. But overall, if you can look at the numbers, you're still far more likely to quit with Champix compared to single form NRT. The numbers seem to be fairly similar between combination NRT and Champix. But certainly looking at the systematic reviews here, 8 studies, all CO verified. So you certainly do get, a very good result with Champix. Looking at some of the other comparisons, lower or variable dose Champix versus placebo. Even if you lower the dose, reduce the dose, you get a superior result with Champix compared to placebo. And we've got 8 studies that show this. And I think this is a really, really important point. Those who are unwilling to quit within a month, but willing to cut down to quit by week 12, using Champix for 24 weeks versus placebo. So these are people who aren't willing to step in right now. These are people that are they say, you kind of typical client that says, look, I know I really should stop, but I really don't want to stop right now. So when these people were given Champix, just to reduce and try and quit by week 12, what the results of this particular study was that 27% were not smoking at 12 months compared to 9.9% with placebo. So that's a huge win if you're someone that's working with clients that are, somewhat unmotivated or are just not willing to step in right now. Just sort of breaking this down into raw numbers, it kind of boils down to this. Numbers needed to treat to get a permanent quitter. You're much more likely to get a win with Champix than anything else. I mean, so on average, you only have to treat about 11 people with Champix to get a win compared to single form NRT and Zyban. So that's, obviously we have to treat a lot of people, but Champix is where it's at for the majority.